Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
You may not have heard about this next cutting-edge laser technology, which is really available for cosmetic enhancement. But the question that many people might have, is it safe? Hello again, and thanks for joining us. I'm Carla Showell-Lee, and you're watching Comcast Newsmakers. In the studio with me this hour is Dr. Harriet Comite. She's a board-certified dermatologist for the American Academy of Dermatology, and today we're talking about Fraxel repair. Thanks for joining us today, Doctor. Nice to meet you.
Nice to see you.
Yes, it's interesting because I've never, ever heard of Fraxel repair.
It's a brand new technology. It was introduced in the beginning of February, and it's such an amazing, exciting technology that I needed to use it right away because it could do things that no other treatment has ever accomplished before.
And is it true that there's only 2 Fraxel repairs in the state of Pennsylvania?
That's correct. I'm one of 2. There's another one located at some distance, and so it's, yes.
Yeah, well let me ask you this. How does it compare to a facelift?
Okay. It's actually better than a facelift because there's less risk to it. You're not under anesthesia, general anesthesia. And in a facelift, your skin does get tightened as it does with the Fraxel. But the Fraxel will also remove discolorations, age spots, sunspots, anything brown, and smooths out wrinkles and lines that a facelift can't accomplish.
Okay, so if you can use technology that we can all understand, how does it actually work? You have a sample of how it's done.
If you want to imagine a picture with pixels, which a lot of people are aware of with digital frames, it actually treats one little microscopic area of skin at a time, and it treats a percentage of your whole face and actually even necks, chests, and hands. And so as it repairs, the openings it makes in the skin is less than 1/10 of a width of a hair fiber. And it repairs very, very quickly. So within a day, you just look like you're sunburned, and you don't have no openings remaining in your skin because it heals so quickly.
Okay, and you compare this, like if you were to look at a hand, you can really see a difference between the before repair of Fraxel and then the after.
Exactly. What you'll see initially is the smoothing and removal of all the discoloration, usually within a month, and then as time passes, your skin will be making new collagen, new healthy collagen and elastic fibers, so it's much more attractive hand. And as well, you can do that on the face, on the neck, on the chest, and all of that together makes people look years younger.
Look at the difference with that. And you say it's not painful.
Well, there is a little bit of discomfort, which we pre-treat with oral medication and topical numbing cream. Once the procedure is over, there's no discomfort at all. You just need to soaks for the first 24 hours or so. You do need to take a few days off from work, maybe up to a week.
Okay.
But by then, you just look like you're sunburned without any pain or discomfort.
So the client that comes to you, Dr. Comite, she is saying, this is what's going on with my skin. Give a scenario of maybe a client coming into your office, what she would need this type of repair for.
Well, a lot of people come in because their skin is loosening. It's not as tight as it was. And they have fine lines or wrinkles and a lot of discolored areas, both red and brown, which they like lightened and brightened. Plus, as one ages, the skin loses its radiancy and glowing. And that's the typical type of person who would benefit from a Fraxel repair treatment. And you only need 1 or 2 treatments.
Really?
Even one treatment can make you look years younger, and it's permanent. The results are permanent as long as you maintain with sunblock, and you don't need to do it again.
African American women get dark spots sometimes from acne or anything, you know, with the skin. Does that help with that type of
discoloration? Yes, it will remove those dark spots, but you need to pre-treat. So it's very important you see a board-certified dermatologist because you could prevent the brown spots from happening and get rid of them as well quickly with treatment.
All right, so we should not take matters into our own hands. We should see a dermatologist when we have any skin issues anyway.
That's correct.
All right, well, information. Thanks so much for joining us. Fraxel repair.
Correct.
All right, Dr. Comite.
Thank you.
Dr. Harriet Comite, she's a board-certified dermatologist for the American Academy of Dermatology. I'm Carla Showell-Lee for Comcast Newsmakers, an exclusive production of Comcast.